Good afternoon, everyone, and you are very welcome to this episode of QPS TalkTime on our health service taking climate action. And today we're going to hear about the impact of the health service on the climate and on climate change, but also I think you're going to hear about the impact of those of us working in the health service can have to positively influence these changes that are happening in our climate. Do follow us on social media. So you'll find us on YouTube at National QPS, and you can also find all of our previous episodes of QPS TalkTime there, and they go back now quite a while, and we've had many excellent speakers, so you can check that out. And we're also on LinkedIn at National QPS. So again, follow us on social media. So just going to let you know about some important resources that are out there. The QPS Competency Navigator is something that we presented a few weeks ago. And importantly, that has a whole section on sustainability competency. So I think it links in very well with today, and I'm sure we'll come back to talk about that. The QR code there will take you to the document. And again, that document is for self-assessment and also to help you find the resources that you need to become more competent in the areas of quality and patient safety, including sustainability that you need. And also to highlight the prospectus of quality and patient safety education that is on offer. And please use the QR code again there to gain access to the prospectus, and you will find a whole range from short courses and short small resources to very large resources and training programs that people can access for free. So, like we said, this is going to be a focus on the environment, on the impact of the health services on the environment, but also the impact of the people within the health services on trying to improve climate change and to do our bit within healthcare. And so it's a real pleasure to welcome our two speakers today. I'm joined by Juanita in the host panel here, and she'll be keeping an eye on the chat, and we'll be having some conversation with our two guests later. So our first guest, Dr. Philip Crowley, it's very good to see you today, Philip. Philip's National Director for Wellbeing, Equality, Climate and Global Health in the HSE, and has been a real champion of climate change over the last number of years, and has always been a real champion for quality and patient safety as well. So I think bringing those two things together is what we're going to hear about today. And Roisin Breen, again, great colleague, program manager for the HSE Climate Action and Sustainability Program. So you're both very welcome. I'm going to maybe hand over to Roisin in the first place, who's going to maybe set the scene for us and tell us a little bit about the challenge and the demand that is in front of us, and then we're going to come back to Philip in a few minutes. So Roisin, you're very welcome to QPS TalkTime.
Thanks so much, John, and thanks, Juanita, and thanks everyone for joining. I'm going to give you a whistle-stop tour about how the HSE is taking climate action. So firstly, just to give a bit of an outline in terms of what's happening in the climate worldwide. So the 2024 State of the Environment report via the Lancet said, we are on the brink of irreversible climate disaster. Much of the very fabric of life on Earth is imperiled, and this is a global emergency beyond any doubt. So despite playing out in front of us and the detrimental effect of same, climate change is the action around climate change is very slow. There are efforts internationally like the Paris Agreement, COP meetings, WHO efforts, to name but a few, but still 2024 had the highest average concentration of CO2 in the atmosphere. We are spewing 162 million tonnes of man-made global warming pollution into the thin shell of our atmosphere every 24 hours, as if it were an open sewer. Fossil fuel use is at record high volumes. The EU is the fastest warming continent on Earth. And instead of the aim of the 1.5 degrees rise in temperatures through the Paris Agreement, we are on track to a 2.5 degrees, if not more, which would see Rio, Miami, Amsterdam and Shanghai underwater. So climate change is the single biggest health threat facing humanity. This comes from the WHO. So between 2030 and 2050, the WHO estimate that we will see 250,000 deaths from climate change. Climate change is indeed a health crisis. There's a significant interplay between planetary and human health. So if you follow the infographic here, you see climate change leads to climate hazards and threats such as flooding, storms, heat waves, air pollution, etc. That then leads to exposure pathways such as environmental exposures, psychosocial, socioeconomic, and these all play out in terms of health impacts. So this one talks to mental health, but there are many others in the literature, for example, cardiovascular, respiratory, and indeed malnutrition. This then has an increased demand on our health services and has a need for our health services to adapt to same. 1 in 4 deaths can be attributed to preventable environmental causes from the WHO in 2023. So what's happening in Ireland? So in Ireland, the EPA released the State of the Environment Report 2024. It actually is very interesting reading. If you're interested, you should have a look. But it does show that the EPA has rated Ireland's assessment for climate as per. And the SAI National Energy Projections, again, it's not a great outlook. We are projected to overshoot our Energy Efficiency Directive 2030 target by approximately 20%. And indeed our 2030 renewable energy share target delays in delivery of up to 12%. So we need to be more resilient and act now together. This is playing out as well massively in our media. We have headlines like Irish children face shorter life expectancy and malnutrition caused by climate change. And you'll see this is confirmed in the Lancet Countdown report from Professor Karen Morrissey, who talks to, we are going to see malnutrition in Ireland. Climate change is going to have a widespread impact on food security. And indeed, we've all been living through various storms, the recent one quite significant being Storm Eowyn, with headlines like hundreds of thousands without power amid danger to life warning as fierce weather events batter the UK and Ireland. So you can see there, I've talked a lot about how healthcare is on the front lines to deal with climate change, especially our emergency departments and primary care, but all of our healthcare providers are seeing the impacts of this. But also there's a bi-directional problem. Healthcare is a major emitter, and we account for 4 to 8.5% of our national carbon burden. So to define the problem, if the global healthcare sector were a country, it would be the 5th largest emitter on the planet. So key sources of greenhouse gas emissions include energy generated from fossil fuels, all the things related to running of our services, healthcare supply chains, and indeed scope 3, which is really all of the things that we inherit from the things that we purchase, so to do with procurement. In Ireland, that can account for up to about 70% of our emissions. So we really need to focus on reducing greenhouse gas emissions and I suppose being in line with government legislation and policy, and indeed have effective leadership and management within the HSE. And above all, we need to promote sustainable practice in frontline care. So we are all being affected now, and despite those alarming stats, we need to turn despair into action. So within the HSE, we have a climate action strategy, which we released in 2023. And we've also been working very closely with our colleagues in Capital and Estates, who have an infrastructure decarbonisation roadmap that really aims to achieve targets of 50% improvement in energy efficiency by 2030, 51% reduction in energy-related greenhouse gas emissions by 2030, net zero by 2050, and phasing out fossil fuel heating systems after 2023. A really important piece to say is that we have a huge body of people who could put their shoulder to the wheel behind this. We've over 130,000 staff within our workforce. And in a recent HSE staff survey, 6 in 10 staff expressed interest in being involved in activities to support positive climate action, which is really fantastic. So within our strategy, we have 6 priority areas of focus. They're hard to see there, but they are up. If you Google HSE Climate Action Strategy, you'll see it there. But there's sustainable buildings and green environment, transport and mobility, sustainable procurement, greener models of care, water and waste management, and adaptation and resilience. And within those, our key focus this year is to provide guidance for services to have real action on the ground to enable us to get to net zero around things like decarbonisation of our fleet, reducing and managing our waste, conserving and reducing our water, how do we procure and buy in the products that we use, And I suppose a really big one to talk about is our greener models of care delivery. So how do we actually deliver our care? What medicines do we use? What different procedures do we use in terms of like single-use plastics, decontamination procedures, etc. So there's like we've had really good engagement from our healthcare specialties regarding different things that they can take and actions they can take within the various specialties. So this year we will be producing a framework and implementation plan around all these 10 areas, and indeed lifting real good ideas that have happened and things that are happening on the ground around the country for spread in other services. And we also have a strong communications and training group and a measurement and assurance group I'll talk to you a little bit in a minute. So really important for us is the structure that we work through. So we have lots and lots of really energized local green teams and services around the country. We know of 138, there's probably more than that. So I think a key thing to take away today is go and see if you have a local green team in your organisation where you work and join up. And if you don't, maybe that's something you could think about starting with like-minded people. Those green teams, we are starting to set up regional networks in each region, headed up by a regional sustainability lead. And over time, we will have regional green committees that will be charged with implementing the outputs of the climate action strategy and the recommendations, and they will feed up into the climate action steering group. So our job in the kind of central team will be to support the regions in implementation of that guidance. We have a very broad staff communications campaign, and we've had really good engagement with it. We've had 3 of them so far with different nudges and different focuses, and this spring we'll hope to launch another one. But from David Attenborough, saving the climate is no longer just a scientific challenge, but a comms challenge. And it's that piece of, not inducing fear into people, but actually, if we really collectively work together, we can make a real impact. So here are some of the tiles. Hopefully you've seen them in your organizations. So these are really nudges and real actions that people can take in their work and indeed at home. So stuff like shifting from car transport to active travel, things like reduce, reuse, recycle, equipment, turning off all your non-essential equipment when you're leaving the office, switching off your lighting. So there's lots of different nudges there for staff across those priority areas of focus. Measurement and assurance is key. So what's measured gets done. So really important for us is the focus of the government climate action plan. So there are 31 requirements within that, and we are mandated as a public sector body to report on that. So it's really good for us to align with that and make sure that we're making improvements around those, but also important that we have health specific measures. So that's what we're really going to focus on this year. So our next report is due in May, and that is available for everybody online to have a look at. But our key thing as well this year in terms of measurement is to get a real baseline of what's actually happening in the HSE. Our colleagues in Capital and Estates have done Trojan work over the last number of years in terms of our energy, but we have a way to come in terms of the other elements like waste, like the greener models of care, single-use plastics, vehicle use, etc. So we are working to, I suppose, better our knowledge around the baseline so we can put in real targets around that. Training is a real focus for the team, and we're really delighted to offer some training opportunities this year. Probably middle of the year, these will be available for people. So leadership training in partnership with Change by Degrees. Hopefully some of you online did the Sustainability 101 training that we did last year. That's a follow-on for leadership. And regional green team training will be provided in partnership with Consultico. And also really exciting, we're developing a HSE land sustainability hub, which will have as a start a 1-hour module for all staff, and then 30-minute training modules on specialty specific green emergency departments, green labs, green theatres, and we're partnering with various colleges to develop those in terms of content. And also I think it'd be really interesting for people to learn more about the impact of climate on health and the impact of health on climate in conjunction with Trinity College. So last year, our Sustainability 101 learners, we'd nearly 1,000 logged on to our Sustainability 101. And it was really, really, after 6 months, heartening to see that over 10,000 individual and team sustainability actions have been logged, which is fantastic, showing that people really were getting engaged. I'm going to finish on these key collaborations. So we're working with Health Innovation Hub Ireland on innovation in products really and services to look at predominantly single-use plastics and trying to move away from that and look at decontamination, etc. So that's really exciting. That will be kicking off this year. And we couldn't be here, I suppose, without our funding and partnership with Spark. They are helping us with 8 projects this year. You'll see that we will be implementing the RCSI Green Theatre Compendium in 3 sites this year. With Spark, we're funding over 30 labs to sign up to My Green Lab certification, which will improve the sustainability of our labs. We are partnering with GPs on 2 projects on social prescribing and working with local partnerships in terms of, walking and getting out into nature, and sustainable diets for chronic disease, moving to more plant-based diets, etc. And also we're funding 4 departments to do the Royal College of Emergency Medicine Green ED programme in conjunction with the college in the UK, which is really exciting, and we're partnering with the ED programme on that. There's also an endoscopy project and emissions for one hospital, a deep dive on that. So just lastly, and I know I've ran through that, there's so much happening and lots of really good work that we'd love to showcase, and certainly through the regional network events, if you'll see those advertised in your regions, you should join up to those to hear more about what's happening in your region. But just lastly, just to end on a positive from our Capital and Estates colleagues, we are trending in the right direction in terms of energy, but there still is a gap to target. So we've seen a 34% improvement in energy performance to the end of 2023, and we are in a glide path to the 50% that we need to get by 2030, which is fantastic. So that's all from me. I'll hand back over to John. Thanks very much.
Thanks, Roisin. That's amazing. You and the team have been incredibly busy, and I think there's also a lot of things obviously on the way that people can engage in. Some nice kind of comments in the chat there. Just Niamh Glashna just saying that the Change by Degrees program comes highly recommended. I think so. That's maybe something people can check out. Gráinne O'Shea as well saying that there are also, it looks like UN resources, UNITAR and UNEP, with free programs there. So.
Yeah, and the WHO as well, John, actually have some as well. So we can share those too in terms of training programs and free online. Yeah.
So that's fantastic, and we're going to, I suppose, come back and talk about, there's no shortage then of things that'll help people to become aware, to start to do things. But I think the challenge for us all is how do we start to turn this into real action? I think, which is what you've been talking about. And I'm gonna hand over now to Philip, I think, who speaking of people of action, Philip, it's good to have you here, and I think that's the challenge, isn't it? Is to turn all of this into action, and not to be paralyzed by the fear of this crisis, but to do something about it.
Yeah, John, absolutely right, and thank you very much for having us on the Talk Time. I helped set up Talk Time a long time ago, as you may remember, and so it's lovely to reconnect with my old pals in the quality space. So, yeah, I mean, the challenge has been laid out pretty barely there by Roisin. I mean, it's, you still meet people who deny the science, and frankly, it's hard to believe that people can still do that, given the overwhelming evidence that we're going certainly past 1.5 degrees, which is the Paris Agreement limit, and therefore the need for urgency. And I guess, look, I work clinically as well, and my clinical work is in the homeless sector in general practice, and it's hectic and mad, and so how do you find time to think about something like this, or how do you find time to prioritize it in your daily considerations, even, and more so even for people, my colleagues in the other national directors managing the health service. They are clearly focused on trolleys and waiting times, and rightly so, because people have been harmed. So that's entirely understandable. Trouble is, it's a cognitive blockage then to actually dealing with something that seems a bit more long term. It's already happening, but it seems long term to people, but it's happening. And when you're dealing with the immediate, it's hard to pull back and deal with things that are going to fundamentally affect the immediate anyway. Because how many people come into our emergency departments every day with respiratory disease, cardiovascular disease, and how much of that is affected by atmospheric pollution that we're still pouring out into the atmosphere? The answer is a lot. So look, I just want to kind of bring it back around to marry up my two worlds of climate and all those other things in my title, which is a ridiculously long title, and the quality space. I put this in as a gratuitous plug for a paper I wrote, co-wrote with Jeffrey and Anu in the BMJ on kind of trying to look at the role of people working in clinical practice. That's people working in healthcare generally. We've a tremendously potentially positive role to play. We can promote public health and awareness. We can oversee surveillance of diseases that we can prove are directly related to climate impact. Where we can promote preventative healthcare, because obviously the most sustainable healthcare is healthcare that doesn't have to be provided at all, because we're healthy and we don't have diabetes, or we don't have heart disease, or we don't have maybe a cancer with some preventable additional initial risk factors. We can advocate for policy changes. So it's not about individuals being tasked with solving this problem. This is a problem of society, of our government, of our health service. And so we need action at a high level, and we can do things ourselves as well, obviously. So we need to advocate for policy changes. We need to look at researching some of the impacts and the evidence for action that work. And as Roisin mentioned, we didn't have time today to share the multiple examples of really wonderful programs and projects that people have undertaken across our health system to address climate change. It's just so heartening to see it, and it's because our staff care about this. 60% of them want to do something about it, so we're going to help them do that. And we can collaborate with others to try and share knowledge and action. And I'll come back a little bit to the degree to which we're collaborating. We collaborate internationally a lot now, because we don't think we can come up with all the answers, and we'd be very foolish if we did. So look, bring it into the area of quality. Obviously, there's the traditional domains of quality, and people who are putting this jigsaw together are probably going to get a bit annoyed with the number of additional pieces of the jigsaw that keep getting added. But sustainability has now been added by the College of Physicians, and it's very, very much being seen, I think, generally as a new domain of quality. I don't think we can have quality healthcare that trashes our environment and our planet. That's a very short-term view of quality again, I think, and so sustainability is really being built into how we view quality, and I think that's very, very much to be kind of commended and welcomed. Some key kind of principles around sustainable healthcare. Just if we think about healthcare generally, let's prevent disease. Let's empower patients to become true partners in their own care. They know more about their diseases than any of us do, because they live with them for 365 days a year. Looking at lean ways of delivering care, lean pathways, promoting clinical leadership that is climate informed, and then provides the kind of leadership across our system that mobilizes our colleagues to promote more sustainable approaches to delivering care. Low carbon alternatives like dry powder inhalers, and getting rid of desflurane and anesthetic gas, for example. Desflurane, I think, is something like 3,000 times the impact of carbon dioxide on global warming, and some of the gases in the inhalers are in the region of 250 times the impact of carbon dioxide. So we've work underway in all of those spaces, and anything anyone on this call could do to support us in so doing, that would be fantastic. Obviously, there's massive things around resource use, energy and waste, and obviously our states colleagues are absolutely leading the way, and leading the way not just in Ireland. I think a lot of people see that Ireland is starting to do something here in healthcare, and that's thanks to some of our colleagues who are on the call here today, and Peter Smith and others, who've shown tremendous leadership and well ahead of when we developed the wider strategy. So we're building on that work and broadening it out into all these other spaces that I think need action as well. Sustainability and quality improvement have already been kind of brought together in various papers. So there's kind of an understanding that quality improvement is a methodology that can help us improve sustainability. Because obviously, while on the one hand, I would say, look, we don't have time for pilots. It is too urgent for piloting things for like a year, seeing if it works, evaluating that, and then abandoning the idea, even though it seems to work. Those days are over in relation to climate change. But it doesn't mean that we can just implement any old idea and say it's a good idea and then realize it isn't a good idea. So that's where quality improvement comes in really well, because it's a kind of it's a rapid test of change. So we can test the changes we want to do using quality improvement methodology, and it's very much becoming embedded in the sustainability kind of domain, if you like, or field. So this is kind of like it's a bit, you could call it maybe a driver diagram. I'll have a better driver diagram in a minute, but trying to look at value generally at the moment, and this is from the Centre for Sustainable Healthcare, and in terms of improving health and reducing carbon, they're so related. In prevention, in a lot of things we do to prevent our emissions, promote healthy lifestyle, like walking to work or using a bike. Lean pathways, we've discussed some of those. Low carbon alternatives, and obviously as states are really driving down carbon within our estate, 4,300 or so buildings, massive estate. Big impact on Ireland's emissions. So we're very much making progress in these spaces. So the value equation becomes this then, in a way. You're looking at, obviously at outcomes for patients, but you're making sure the environmental, social, and financial impacts, which are like a triple bottom line now, are being minded, and that we're not ignoring them in kind of blithely going down outcomes and ignoring impacts. So it is a balance, but obviously outcomes are the top line, not the bottom. So we can integrate sustainability into the kind of main QI elements. You know, sustainability is a domain of quality, as already mentioned. It can help us set intelligent goals that include sustainability in our goals. When we study the system, we don't just study kind of what we traditionally study. We can also look at some of the carbon impacts and the resource use impacts of the kind of decisions we make when looking at our system and how our system operates. Look at the massive amount of waste in our system. It's quite phenomenal, the amount of stuff that we waste. Plastic, we're massive producers of plastic. And plastic has all kinds of impacts on healthcare, on health, on our health, microplastics. So designing then for the improvement, obviously I've talked about using QI methods, but building it into sustainable clinical practice, and measuring the impact. Obviously, that's if anyone's done anything about quality improvement, they know you can't do things if you don't measure them. You don't know if you're making any impact if you don't measure them, and you can blithely continue doing the wrong thing if you don't measure them. So measurement is really key in this area as well, and it's not straightforward. So measuring carbon impact is something we're doing a lot of work on at the moment, and we will be better at in the hopefully near future. So just looking at the next slide then at the 4 principles of sustainable clinical practice. Patient empowerment, self-care, I've already mentioned, prevention, lean service delivery, and low carbon alternatives. These are, if you think of all these 4 things in our clinical practice, we'll be moving definitely in the sustainable direction. This is probably too small to read, but it just, I suppose, what it shows is, in terms of an inhaler QI project, you can use tools that we use in quality improvement all the time, like a driver diagram. It breaks down the problem into what are the primary causes of the problem, what are the secondary causes of those primary causes, and then what actions will you take to address each one of those? Because if you don't break things down like that, I think you don't end up understanding all the things that, so you could be tackling driver 1, but driver 2, 3, 4, and 5 are working assiduously against your efforts, and so you end up actually not improving anything at all. So you need to see things in the broad, and that's why breaking problem down like this, and that's why that's why I love QI. I mean, QI is simple in many ways, but we don't use it half enough of the time, and it's lots of simple tools to help us, kind of address problems that we need to address, and equally in the area of sustainability. So in our next slide, then, I think the values of QI for me support the drive for sustainability, the belief that we can change things and the ability to execute it. If we don't hang on to that belief, if we become defeated and anxious and overwhelmed, we're not going to do anything, are we? So the concept of teamwork, I think, is central to QI and is central to this as well. Testing changes and winning hearts and minds, all kind of quality improvement things that I've learned from my many years working in that I bring to this, and I think are absolutely important. System awareness, key. We need to know how the whole system works. Otherwise, we address one part of the system, and that's to say another part of the system will undermine what we're doing. We need to define the problem clearly and measure it. We need to innovate because we don't have all the solutions. So QI methodology to test is really important. Partnering with staff and patients and leadership, all critical elements of a quality improvement journey and of a sustainability journey. So having kind of, if you like, highlighted the massive overlap potential overlap, at least between quality improvement thinking, methodology, approaches, and sustainability and climate change approaches. I just want to share a few other things kind of in this space that maybe relate directly back to maybe to people on the call. So first of all, I've talked about partnerships, international partnerships. One of the things we decided to do, we joined the Climate and Health Alliance, which maybe is a little bit surprising in that it's a campaigning group that will be campaigning with us, or campaigning to pressurize us to do what we're committing to do. But our approach has always been very much from the outset that bring on the pressure, because only with kind of an accumulation of pressures and voices and evidence and people highlighting things that need to be done will we really take some of the tougher actions that we need to take to really address this. Because some of them will cost a bit of money in the first instance, and we have to bite that bullet if we're going to not pay the enormous costs to our healthcare system of a planetary environment that causes so much more disease and migrations and all kinds of problems that will create further issues for our health service. So we wrote a declaration, fairly comprehensive declaration on climate change, fairly demanding thing to sign, and we have 33 healthcare organizations already signed up. And you can see the kind of people who are there already, and others are continuing to sign. So I think what that message that says is, or signals to people, is that it's not just a few people banging on about this. It's not just a few kind of zealots or whatever. This is everybody's business. Everybody now understands this. All the people we associate with in other organizations, they're all getting in on this because they're worried and they want to be part of the solution. And they've signed this declaration. And the HSE signed it. And it was a challenging thing for the HSE to sign, but it signed it. So fair dues, I think, in that regard. So just to say, we're not alone. And there's a lot of people trying to do stuff, and we're doing it together. We're not doing it on our own either. Are we all taking climate action? I mean, this is not an individual solution. We are not saying to any individual listener on this call that it is your responsibility to tackle climate change. It simply is not. It may be part of your responsibility, because I think it's part of everybody's responsibility. But I've said before, it's part of our management's responsibility, it's part of our health services responsibility, it's part of our society's responsibility, and it's part of the EU, the WHO, it's part of global needs to tackle this problem. So we may be small cogs, but as we've tried to point out, the health service is not a small impact on emissions in Ireland, and Ireland per capita are big emitters, looking at the globe. And that the impact of that is going to be felt unequally by those who are low emitters. So I think we need to think about our work environment and maybe choose something to tackle, apply QI methods to it, around energy use, maybe biodiversity, waste, clinical practice, focusing on prevention, sustainable transport, telehealth. Telehealth is a wonderful solution to a lot of our clinical needs and clearly our sustainability needs as well. So write down a smart aim, get what you think are the measures of success you think you'd associate with that, design a test of change, test it, review it, use QI, in other words, to try and test your change locally. But when you're doing all of this, get other people on board. Ask your management team, what the hell are they doing about this? Because if they're not doing something about this, they're asleep. And frankly, that's the only way I can put it. So put people under pressure. Your influence is your superpower. So just looking at the next slide, then, people like Quig, this is a veracity index. Who do we trust most? And as a doctor, I sometimes joke and say, well, it's a bit annoying that the pharmacists have overtaken us or whatever. But I mean, obviously, there's different groups who oscillate up and down. But you can see the kind of people in society who are trusted. And it's us. People trust us. They don't trust, the clergy very much anymore, or economists. They trust us, and to a remarkably high degree. So that gives us an opportunity to say things that we know are true and that we think are important, that will hopefully change people's way of viewing things. And certainly we in the climate team are going to use whatever trust people have in us to do just that. So we just look at the next slide then briefly, and then we conclude. Yeah, so I think we need to do all of these things. We need to get sustainable education into training of people working in clinical care, because healthcare is crucial to this challenge. We need to embed sustainability into our way of thinking, therefore our culture. We should be developing QI capability at the same time as sustainability. I know there's a lot of training and tremendous resources coming out of the quality team, which is wonderful. We need to look at achieving high value but maximizing efficiency. So in other words, stop doing things that are a waste of time. We do far too many tests on people, far too many blood tests, far too many MRIs, far too many CT scans. I was in the ED in Vincent's one night on a kind of a management exercise. I spent the night in the ED. I wasn't sleeping. I had to sit up and look at the practice. And at one of the handovers, they were saying this guy came in with a sore head or headache, I guess, and he'd had a CT brain. It was normal. And I put up my hand and said, I don't think I was as rude to say what a surprise, but I think I said something along the lines of, I'd done clinic that day and I'd had at least 4 people with the same symptoms and they got paracetamol. So I know why people do this. I know why I do it. I know why we overtest, because we get sued the whole time and we get criticized, and we, you know, if we appear, it appears that we don't care if we don't do an intervention. But there is a middle ground somewhere where we can try to manage down some of that stress and demand, and work with patients to understand. Like, we're working with the Asthma Society to get to low impact inhalers. So we're not going to post something on people with asthma that they don't sign up to themselves. So getting people on board can help us manage down some of those demands as well. So try and use high value interventions to get rid of the low value ones. It's phenomenal the amount of low value work we do, and we must pivot healthcare to prevention, I think. So just start my final slide, then you'll be glad to hear, because I could talk about this forever, of course. Is you can't, you know, no one is going to do any of this on their own, but we have guides for people. And they're readily available on our website, and we hope to continue to disseminate them. There are dissemination challenges. There's so much stuff going out to all of you. We're competing for headspace and, you know, dissemination space and everything. But anyway, we have all these guidance around simple things that you can do. So if you have a climate sustainability team, or a regional green team, or a local green team, or energy team, find out about them and say you'd like to help them in some way. And I know everyone's incredibly busy, but it'd be a great thing to do. And I think it's good for, we feel good when we do these kind of things, because we know they're the right thing to do. Look for opportunities to take action for a particular challenge. Make one specific change, maybe spread the word to your colleagues and get training. But really, challenge management, challenge us, challenge everybody who's got any decision-making power to get on board with this and get going. So that's really all I wanted to share with you today, and we'll take any questions in the chat box or anywhere else. Thank you very much for listening.
Thanks, Philip. And that was a real call to arms, I think, for everybody to get involved and to play their role and to be the influencers that we all can be. And I think I absolutely agree with you on the importance of you know, sustainability being part of our core idea of what quality is. And I think, you know, it really has been the only big addition, I think, since those original ones of being safe and person-centered and effective. And I can't think of any other one that's going to come. You know, I think it's really important. I think it'll be impossible for us to think about quality without bringing sustainability into it in the future. And I think you've made a very good case for that. And how useful QI as a way of approaching problems can be. And I think we know a lot about QI, and we've lots of people out there who can do it. So I think bringing kind of those people and their skills in to try and solve this problem, and trying to reduce that low value care, because it's not low value in terms of just money, but we do save on the money if we stop low value care, but we also save on all that wasted carbon that we put out there in doing MRI scans that might not be needed, or blood tests. So fantastic. I think our audience is lit up there, and we've got great chat. I think certainly, I think, Philip, you'd mentioned it's important that we're not alone in this, and I certainly don't think we are alone. I think we've got lots of people who are here today to share their interest. I see Caoimhe O'Sullivan up in the HSE Dublin Northeast, and they're doing work with the Health Service Improvement Team. So it'd be good, even if Caoimhe, you want to put into the chat even some of the things you're doing. Teresa and Aoife from the ICU in Mullingar, I think, have joined. Specifically, they want to set up an ICU green team, and they're looking for some ideas. So there's lots of interest and passion out there, I think, in people. We have a few questions. Juanita, do you want to maybe direct any of the questions there?
As you do that, just to say, anyone on this call who has an idea that they're, I mean, I'm wary of saying this because it's a very small team, but at the same time, like, if you're experiencing a stumbling block, just email us. You know, if people are blocking intelligent action, just email us, and we can see what we can do to them. That's the role of people at a national level, is to try and unblock things that are just annoying, really.
And you're there. That's what the function of your team is there, to help people, to enable people. One of the themes of quality improvement, I suppose, is how do we make it easy to do the right thing? So, it's easy to get in touch with your team and to seek advice and to look for partnership, isn't it? Juanita, do we have some questions coming through, or comments?
We do indeed. There's a few pieces coming in here through the chat and through the individual chat from people. And just to say, it's one of the most engaged chats on QPS TalkTime I've seen in a while. I love the amount of people that have shared resources that are there, training programs that they've done. And there's a few meetups coming for people that wanted to join green teams as well. So it's fantastic to see that. So do take a look if you're interested in that. I suppose one of the questions that's coming through is, you talked about the people that maybe don't believe that climate change is real. And maybe Philip, I might share this one with you. Are there any, or is there any guidance for having sort of respectful, open conversations with somebody that doesn't actually recognize that this is a challenge or a problem?
That's a really good question, and you could answer it in a number of ways. Some of them not so
diplomatically,
more serious than others. It's funny. I don't know if anybody's ever heard of Noam Chomsky, but he's an amazing commentator. He's a linguistic professor in MIT, but he's a critic of U.S. foreign policy essentially, and he writes very, very well. And I knew his door, so I met him at a thing, and one of the questions asked of him was, "What do you do when you're banging your head against a brick wall and you're trying to get something like this across the line, or somebody to take something seriously?" And one of the options is just to go around the wall or dig under it. You can't bang down the wall. So, like, I meet people, and because people know that I'm involved in this, some people deliberately bring it up in conversation, even socially, to try and annoy me, and it's pretty effective. And sometimes you just say, whatever. If frankly, if at this stage you're not convinced about the science of climate change, if you haven't been exposed to it, let me tell you about it. But if you're not convinced, you're exposed to it, you're not convinced, I probably won't convince you. I mean, in all honesty. So I wouldn't take on, battles that are unwinnable. That's generally good advice in life, because life is too short. But yeah, I mean, I think one can respectfully at least say, if it's in the public domain, I won't let somebody deny climate change and leave it unchallenged. I can't do that because I won't have done my job in that precise moment. But I would always be very respectful and say, look, there may be different views, but the evidence is overwhelming, and it's in the public domain. And I can point to some sources of it, the Lancet Commission on Sustainability. And kind of leave it there. Let people chew over it, and obviously it's very reasonable to point out that things that happen in Valencia, I mean, why do they happen? I mean, is it just heavy rainfall that day, or frankly, why do the Palisades happen in Los Angeles? Why are these things happening way more frequently? And you can put it back to people, and they'll come up with some kind of a theory, I'm sure. But don't bang your head against a brick wall. That's all I'd say about
Maybe just to add to that, Juanita, we are working on a Did You Know campaign, which is kind of based on like science stats, like hard evidence, and then what the HSE is doing to address it. So we will have some nice resources available on that as well, which kind of really are evidence-based stats, high level, that should help to educate people around it.
And Colin O'Hare's an interesting point there as well in the chat. Colin leads on climate in the department and is our friend and colleague, but just around the fact that we have a national policy on this, and we have targets that are set by law. So we can skirt around it all we want, but it's going to come back and bite us. And we have to report on this as a health service. Comprehensive set of measures.
I think the other thing just to mention there, Juanita, as well, is and Philip mentioned already, is pollution. I think is undeniable, and it's separate from climate change, but the two are obviously very related. But the impact of pollution on respiratory illness and possibly lots of other illnesses, I think, is very strong. I think the evidence for that. So,
I just saw a text there saying that a fire alarm was going off in Dr. Stevens, so they had to leave the call to leave.
Oh, wow.
I wonder if that climate related or anything.
We should say to people that it will be possible to watch it back on YouTube for anyone that did have to step out with the fire alarm.
I think it's just gone off. But anyway.
Just gone off, and I should say as well, just for people, it comes back to the quality improvement piece. I think from what you're saying, then Philip, is it's working with the willing where you can, and we do have the target, so we do have to keep the job and get the work done, because otherwise we're going to be in serious trouble. We are in serious trouble. One here maybe for you, and it's coming in from Dominic Foley, and he had a question around point 10 of the strategic objectives, and how would the National Environmental Health Service bring about action or policy to protect and promote health and welfare of the public with regard to health risks.
Yeah, so yeah, no problem, Dominic. So we have Dr. Ina Kelly is Public Health Lead for Adaptation and Resilience. So Ina is working with various different departments, including environmental health, to ensure that we are delivering on the government adaptation plan for health, but also, I suppose, more specific to HSE in terms of measures. So I know that some of your colleagues within Department of Health would be on those specific working groups. And also, I think a key thing to mention for this year, and I see Colin is online, is the putting together a new adaptation plan for health, which both environmental health colleagues and indeed Ina and anyone else working in that space will have an opportunity to contribute to. So Ina is doing a piece at the moment, which is really like showcasing where we're at in terms of delivering on the adaptation plan for health, which will be inclusive of environmental health and their inputs into SAME. So I hope that addresses that, yeah.
That's really helpful. And I have one more before I'll go back to you then, John, and it's just from Carola, and just how are managers motivated to align resources to sustainability measures within their service, apart from staff challenging them? For example, is it going to be included in the KPIs? And I think maybe that, you know, Colin has touched on that a little bit there, but do you want to add anything to that?
Yeah, I think it would be important to say that in the first instance, the focus of the team has been the Government Climate Action Plan and the 32 mandated requirements within that. But obviously that's not health specific. So as we come out with our recommendations now, hopefully at the end of March, we will be producing a measurement plan associated with that, which are more health specific. So that will go down through the regional green committees and be channeled out to services. So yes, I would see as the year goes on towards the latter part of this year into next year, we will definitely be including some KPIs. And as I alluded to in the slides earlier, our issue with KPIs is having a baseline, having an accurate baseline. And that's the work that we're doing at the moment with Healthcare Without Harm Europe, is to try to get that baseline across key measures that will enable us then to put in a target and a trajectory to which we can aim towards. So in answer to the question, we're working on it, and it will be something that will be coming kind of later stages this year. Yeah.
Crucial question though, because in a way, you know, if I'm working in my homeless service, if I say, you know, I want to change things there, and nobody else gives a damn, you know, it's very disheartening. It's very difficult, and it's good if levers are brought to bear. And we certainly intend to do that, as Roisin has said. But we're very much in the support frame of mind rather than in the you know, knocking people in the knuckles frame of mind. But at the same time, we need the responsibility for this needs to lie where it does. So we will ensure that it does.
Okay, brilliant. Thank you both for that, John.
Yeah, look, fantastic conversation, and again, lots of comments coming in the chat there again. I suppose in QI at the moment, the big term is co-production. You know, how do we do these things together? And maybe that's just where we might kind of conclude where are the things that we can, you know, how can our patients help? How can we help as individuals? And then as we get into, you know, organizations, and the HSE in many ways is an umbrella of many organizations or systems, you know. Just your thoughts, maybe just 2 or 3 things that maybe we could do this week or in the next month, or, you know, in the near term, that will start to make a difference.
One thing would be make every contact count. It's a program, the health and wellbeing promote. Takes 1 minute. I use it in the homeless service. We're jammed out. You can still find 1 minute if you do the training. You can find out. It's a methodology that works. You can change people's behavior towards a more preventative mindset and want to be healthier. Everybody, including the homeless, want to be healthier. And so I think making every contact count would be one good thing. Looking at, you know, checking out your green team and making a connection there, and you know, giving your management teams a flea in the ear if they're not doing enough about it.
And I think as well, Philip, from our team's perspective, we're really going to try to focus on, so far our comms program has been internal comms for staff and staff awareness, staff education, but we want to try to start moving in the directions of our patients. So that piece of, so they understand what is the climate impact on health, and also why we're doing this, so that there's not a bit of a kickback, that they can, simple messaging around that and what they could do to help. And there's really great examples of how patients are actually involved. Like the winners of the HSE Excellence Award Sustainability category was Prosperous Healthcare, which was really based on service users who were being involved in green initiatives, like a vegetable garden, doing energy audits around the site, like lovely examples of how actual service users were part of the actual team and delivering on improvement initiatives. So yeah, I think that's a really good example.
Well, that's fantastic, folks. Thank you so much. I think, like I said, we've lit up the chat, and I want to thank Juanita there and Chris in the background, who's helped us bring today's episode together. So, look, I look forward to hearing more from you, and we will be watching closely what you're doing, and certainly it's very important to us, I think, in quality, that it's sustainability must be fully integrated into how we think about quality. So thank you, Philip, and thank you, Roisin.
Thank you, guys.
Thanks for having us. Thank you. Thanks a million.
Okay, folks, that's it from us today. Thank you for joining us, and you can watch back previous episodes. The QR code will bring you to that if you want to watch episodes that you've missed before, or if you're looking for something interesting to do. How better could you spend a day than browsing our back catalogue of QPS webinars? And then just to flag our next one on Friday, the 7th of March. So we usually obviously happen on a Tuesday, but on this occasion, this is Friday the 7th of March, which is Friday week, and we are taking advantage of the fact that I think we have a collaborative workshop in town, so we will be sending some more information out about that closer to the time. But if you want to scan that there and stay informed, and we will be posting about that shortly. So that's open there for that one with the ISPO team on the March the 7th. So again, you will get a form today just as you close out. Please give us your feedback. We do use it, and we apply it, and you'll also get a notice to say you've been here, or you can just scan the QR code and give us your feedback through that. And I look forward to seeing you at our next QPS TalkTime webinar, and enjoy the rest of your day. Thank you.